Hi, I am Dr. Raghav Malik, consultant, cataract and refractive surgical sciences at Center for Sight. So one of the most commonly asked questions that we get is, or we are always discussing, that will AI replace doctors? We know AI has replaced so many jobs. There are so many jobs that have been taken over by AI. But can the job of a doctor be taken over by AI? In my opinion, I think it's impossible. So what does AI stand for? AI stands for artificial intelligence. Intelligence is something that can be made artificially. That is, by feeding a machine, feeding information into a machine, you can always make that machine intelligent, which is called artificial intelligence. So yes, if you input some amount of information into a machine, you can make it intelligent. But can that machine treat you? I think no. Why? Because there is certain amount of emotion also required to treat a particular disease. Just imagine there is a doctor who is taking care of your disease, he's giving you medication. Of course, so for a particular disease, only a particular medicine is required. So that is something that is a very simple job anybody can do. But to diagnose that particular disease, to know whether this medication will suit you or not. And let's say the medication has been given and you come back to the doctor saying that, doctor, this medication is not suiting me. Now what? So that is when the emotion of the doctor comes into being. You must have heard of AI, but have you heard of artificial emotion? I think not. Why? Because emotion is something that is inherently born only in human beings. So the job of a doctor is such to have intelligence as well as emotion, to know who should get that treatment, who should not get that treatment, and when to stop giving that treatment. That is very, very important. So I believe that the emotional aspect is a very big aspect of medicine, and that cannot be learned by a machine. No, AI cannot replace doctors ever. Also, a very important aspect of medicine is the ethical consideration, knowing what is right, what is wrong. Because certain types of treatments require a lot of ethical consideration, and it needs to be thought out by a group of doctors before it can be given out. Let's say even the vaccine for COVID, when that came out, that required a lot of consensus. A lot of doctors had to sit down and decide the type of medication, the type of strain that is to be used. That only requires a lot of knowledge, a lot of ethical considerations, and also compassion, which would be lacking in an AI machine. So that is why I feel that AI can always aid a doctor in becoming a better doctor, but will not be able to replace doctors, neither in the near or in the far future.
Follow Center for Sight and post your queries to get answers from the experts.